The top stories tonight in Y News. President Rodrigo Duterte orders expanded PhilHealth coverage for COVID-19 patients.
Government expects shipment of 2 million doses of Sinovac and Sputnik V vaccines this month.
Hospital group suggests the use of COVID-19 self-swab test. Former President Erap Estrada is still battling against COVID-19.
LG Electronics is shutting down its smartphone business worldwide.
And nearly 500 persons deprived of liberty in Quezon City were given free meals by the Members Church of God International. Good evening, Philippines and the world. Today is Tuesday, April 6, 2021. I am Herlene Delgado.
Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
First in the news. President Rodrigo Duterte has ordered the Philippine Health Insurance Corporation, or PhilHealth, to include in its COVID-19 coverage patients staying in accredited isolation centers and tents. Meanwhile, around 2 million COVID-19 vaccines are expected to arrive in the country this month. Rosalie Coz reports.
Intensified health support for COVID-19 patients is expected from the government. This after President Rodrigo Duterte directed the state health insurer PhilHealth to include COVID-19 testing, isolation, and hospitalization of COVID-19 patients under its health insurance coverage.
Nagbigay ng direktiba po ang ating presidente sa Philippine Health Insurance Corporation na kasama sa health insurance coverage ang RT-PCR test, isolation sa accredited community isolation units at hospitalization para sa mild at critical cases ng COVID-19.
The palace official reiterated that under the testing protocol of the country, PhilHealth will subsidize the cost of RT-PCR tests for medical and economic frontliners, others who have great exposure to COVID-19, and those who have COVID-19 symptoms.
At most, ang babayaran nyo po 300 pesos, no? So, ang bayad po dyan PhilHealth, no? Kaya nga po billion-billion, yan po ang single largest expenditure ng PhilHealth. So, hindi naman po tama na sabihin natin na hindi tayo nakapagbibigay ng libreng testing sa ating mga kababayan. Wala pong dahilan para hindi PhilHealth ang magbayad ng inyong PCR test kung qualified ka makakuha ng PCR test.
Secretary Roque also mentioned that patients staying in tents as part of the hospital's inpatient care must also be covered by the PhilHealth assistance. Meanwhile, Vaccine SAR and National Task Force Chief Implementer Secretary Carlito Galvez revealed that 2 million doses of COVID-19 vaccines are expected to arrive this month, particularly Sinovac and Russia's Sputnik V vaccines.
Darating po ang Sinovac na 1.5 million at saka meron po tayong Gamaleya na 500 or more or less 2 million doses.
The vaccination program of the government will also be intensified in COVID-19 hotspots of the country, particularly the NCR Plus, Cebu, and Davao cities. Apart from this, the government is eyeing to vaccinate economic frontliners in May when around 4.1 million doses of COVID-19 vaccines of Sinovac, Gamaleya, and Moderna are due to arrive in the Philippines. Rosalie Coz, UNTV News and Rescue. We serve the people, we give glory to God.
The first modular hospital in the country opens in Quezon City today. The Department of Public Works and Highways says they are targeting to build more quarantine facilities in Metro Manila. Let's find out why from Asher Cadapan Jr. live. Yes, Asher?
Manila asked for help as they are overwhelmed with COVID-19 patients as cases continuously rise, particularly in the National Capital Region and adjacent provinces. With this, the Department of Public Works and Highways opens today the modular hospital built in Quezon City, the first of its kind in the country. Compared to quarantine facilities which isolate asymptomatic and mild COVID-19 cases, modular hospitals are designed to administer severe and critical patients with the deadly disease. Here's an excerpt of our interview with Isolation Czar and DPWH Secretary Mark Villar.
Actually, it can function as a ICU, also hospital. So fully functional siya, marami po siyang features. Katulad ng oxygen, negative pressure rooms, paging system for the nurses, and of course, other facilities na kailangan.
The fully air-conditioned facility has 110-bed capacity. It will serve as an extension of Jose R. Reyes Memorial Medical Center, and personnel will be provided by the Department of Health. The government spent about 240 million pesos in its construction, which started in November last year. According to the DPWH Secretary, more modular hospitals will be open next month. Additional quarantine facilities will also be constructed as the existing ones have already high utilization rate due to the rising COVID-19 cases. Once again, here's Secretary Villar.
So sa ngayon, 75% ang utilization rate sa ating mga quarantine facilities NCR. Nationwide, the average is about 15%. Pero mataas talaga yung NCR, pinakamataas sa NCR. Kaya sa NCR kami nakatutok ngayon at magtatayo pa kami ng additional facilities.
And that's the latest on my end for tonight. Back to you, Arlene.
Thank you, Asher Kadapan Jr. reporting live.
Meanwhile, the government might downgrade the quarantine level in Metro Manila and 4 provinces to modified enhanced community quarantine or MECQ to curb the spread of COVID-19. Joanna tells us why.
Based on the latest report released by the Octa Research Group, the COVID-19 reproduction rate in the National Capital Region again slightly slowed down to 1.53, which is lower compared to 1.6 rate recorded last week. According to the research group, if the reproduction number declines more to around 1.3 to 1.2 by the end of this week, the quarantine status in the NCR Plus may be relaxed to modified enhanced community quarantine or MECQ.
We recommend that the GCQ be followed by the ECQ be followed by an MECQ before we go to the more liberal GCQ. So a step down approach so that we can sustain the gains that we have achieved and of course the sacrifices we have achieved over the last 2 weeks.
However, if the transmission rate of the virus becomes steady at 1.5, they cannot recommend the MECQ in the NCR Plus bubble by next week. Based on the latest projection of the Octa Research Group, the country may reach 1 million cases before the end of April. It can be observed that there are several times that Octa's projection is hitting the actual figures of COVID-19 cases reported by the Department of Health. Some of these were the 8 to 10,000 projection of new daily cases by the end of March and the 16,000 estimate by April. Octa pointed out that strict enforcement of quarantine restrictions should always be observed.
We are hoping that itong linggo na ito, itong extension ng ECQ ay sana paitingin pa ang implementation and sa public natin na magano lang ng self-discipline sa paglabas. Sana yung paglabas nila ay essential travel lamang at and when they go outside to practice dapat and yung minimum health standard. So again, USEC, I think it's too early for us to say if it is going to warrant a step down or a further extension.
According to the World Health Organization's latest report, out of the 24 countries in the Western Pacific region, the Philippines was on top with the highest number of COVID-19 cases as well as new cases recorded daily. Philippines is followed by Japan, Malaysia, Republic of Korea, while China, where COVID-19 emanated, was on the 5th place. Although Octa Research Group observes decline in COVID-19 growth rate in several cities such as Manila, Pasay, Marikina, and Parañaque, the healthcare utilization in NCR Plus bubble will continue to remain in critical for the next few weeks. Joanna, UNTV News and Rescue. We serve the people, we give glory to God.
The Department of Health reported additional 9,373 new cases of COVID-19 today, raising the nationwide tally of confirmed cases to 812,760. The number of active COVID-19 cases in the country also increased to 152,562. Meanwhile, the DOH said 313 more patients have recovered from the infectious disease, increasing the total number of recoveries to 646,381. On the other hand, 382 new deaths related to COVID-19 were reported, pushing the country's death count to 13,817. The DOH said 10 testing laboratories were not able to submit their data on time to the COVID-19 document repository system on April.
An organization of hospitals has recommended the use of self-swab COVID-19 testing. Nel Maribuhok explains why.
The president of Philippine Hospital Association, Dr. Jaime Almora, in his Facebook post explained how to do the nasopharyngeal swab testing by yourself. He said it is more comfortable of doing it on your own given it is guided by medical professionals.
First thing to do is to lift your the tip of your nose a little upwards and direct it horizontally. If you are looking up, you should be directing it downwards. If I feel a resistance, I will just try to locate what to go down. Okay, this is not painful. There's just a little discomfort. I am now in the nasopharynx. I can feel the tip in my nasopharynx, so I'll just twirl it. If I went up, it would be painful, very for sure. But I'm not feeling anything, just a little discomfort. Twirling it backwards.
According to PHA's president, he already wrote to the Department of Health and to the COVID-19 Interagency Task Force to approve use of self-swab COVID-19 test. This is to expand the country's COVID-19 testing capacity, which currently have 50,000 daily testing capacity.
And if people will buy the rapid antigen test and do it on themselves, then we will be able to do a surveillance or screening. What we are doing now is we are not doing a surveillance. But if people will do it on themselves, then we can have a surveillance. So even without symptoms, we will know who are positive for COVID, and we can do isolation or quarantining better.
The Private Hospitals Association of the Philippines expressed support on the measure.
Yes, I think it will help a lot. Basta meron lang talagang guidance at saka yung tamang ng mga medical workers kung paano ang tamang pag-swab sa sarili mo. Pwede yun.
The Health Department has yet to comment on the recommendation, but the DOH already said that self-swab testing is not recommended, especially without the assistance of a licensed medical professional connected to a licensed RT-PCR testing laboratory.
And we should have a licensed laboratory overseeing them.
Nel Maribuhok, UNTV News and Rescue. We serve the people, we give glory to God.
Former President Joseph Erap Estrada is still battling against COVID-19. In a Facebook post this morning, his son, former Senator Joseph Estrada, says his father's pneumonia worsened since yesterday. This prompted the doctors to place the former president on mechanical ventilation to improve his oxygen delivery. The former senator is asking the public to continue praying for his father's immediate recovery.
For those watching our 24/7 live streaming on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook. A maritime law expert believes that filing diplomatic protests could stop Chinese incursions in the West Philippine Sea. Leah Ilagan explains why.
The Philippines should not stop filing diplomatic protests against China over the presence of Chinese ships at Julian Felipe Reef in the West Philippine Sea. even taking surveillance photos for public release. Maritime expert and University of the Philippines Professor J. Batumbakal said on UNTV's Huntahang Legal, in this way the whole world would know about China's violation of the international law.
Parang na-play up ng konti at pinapakita nga po sa mundo kung ano yung ginagawa nilang mga maneuver doon na nakakabahala. Dahil doon, nakatuon din ang maraming ibang bansa dun sa lugar. Nakita natin, naglabas agad ng statement ang mga ibang bansa tulad ng US at ang Japan at iba pa, no? Expressing support for our position. Kasi nga po, yun din po ang magagawa nila sa ngayon, magbigay ng parang diplomatic support or moral support sa Pilipinas kasi dahil itong area na ito ay EEZ natin, no? At ang issue na to ay bali sa atin talaga, jurisdiction natin yung at stake eh. So, hindi sila pwedeng mag-intervene directly. Ang kailangan nilang gawin ay suportahan ng Pilipinas dun sa ginagawa niya.
Due to the diplomatic protest filed by the DFA and the pictures released by the Armed Forces of the Philippines, China was forced to remove some of their ships in the reef. From 220, then it was only 45 now. Professor Batumbakal believes China is very unlikely to start a war to finally conquer and own the West Philippine Sea.
Magiging mas disadvantageous sa kanila kung mangyari yun. Magiging involved kasi yung mga external powers. At pag nangyari yun, sila rin yung tatamaan, no? Dahil malaki doon sa proportion ng trade na dumadaan sa South China Sea, mga 40%, no, ay sa China nagpupunta. So yung kanilang imports and exports nagdadaan dyan. So lalong madidiskarel yung kanilang ekonomiya pag nangyari yon.
But he said it was China's tactic to park their fishing vessels on the reef for a long time and conduct civilian activities such as search and rescue in the areas they want to place their structure.
Hindi siya nagpipigil dito sa mga measures short of war, no? Yung gaya nitong mga gray zone tactics na tinatawag, yung pagpapadala ng kanyang mga fishing vessel at maritime militia. Yun ang ginagamit nila na paraan para makuha yung mga objectives nila dito sa South China.
Professor Batumbakal added that the issue on the West Philippine Sea will remain until the next administration.
Problema po na ito ay hindi lang dahil dito sa administrasyon na to, magtutuloy po ito, no? Kaya yung next president, yung next administration, sigurado po haharapin pa rin yung ganitong mga insidente at ganitong problema. Kasi po ang China, tuloy-tuloy po yung kanyang kumbaga plano dyan, yung strategiya niya dyan, talagang slow and incremental na takeover ng South China Sea.
It can be recalled that the Chinese embassy maintained that the Nansha Island is part of the South China Sea, the area where Chinese vessels have been fishing for a long time. Leia Ilagan, UNTV, News and Rescue. We serve the people. We give glory to God.
In other news, the government is considering to set a suggested retail price for pork and chicken. Ray Pelayo will tell us why.
The Department of Agriculture believes that price ceiling implementation was effective in controlling the prices of pork in the country. This even if the 270 to 300 pesos per kilogram price cap was not followed in the past 2 months. Before, these prices of meat skyrocketed to 450 pesos per kilogram in February.
Successful yung overall lahat ng measures towards the price cap, at least hindi na umabot ng 400.
Now, prices of pork in Metro Manila markets ranges from 350 to 400 pesos. The DA is now looking into setting a suggested retail price after lifting the price ceiling for pork and chicken on April 8.
We are looking at the SRP structure, so pero wala pa kaming recommendations. We will finalize before April.
The DA will also assess if it will continue the transport assistance for hog raisers from provinces delivered in Metro Manila. A group of dealers and vendors in Commonwealth Market opposes the setting of SRP but favors the implementation of price cap.
Mas lalong walang masasagot na price cap at least pwedeng magkaroon sila ng net, mataas ang bubos, ganito, pwedeng magsinungaling.
Meanwhile, the farm gate price of chicken decreased by 40 pesos per kilogram since March 12. The United Broiler Raisers Association said this is the effects of the past holiday season and the re-implementation of the ECQ.
May impact na talaga yung lack of purchasing power ng consumers. Down talaga ang economy natin. Ang curfew nila ngayon is 6 o'clock. Ang malaki nawawala sa demand, yung kahit yung mga lechon manok apektado.
The group favors the implementation of SRP provided that prices will be recomputed to reflect the appropriate price. UBRA, on the other hand, opposes the implementation of price ceiling.
The price cap will be counterproductive because you are distorting the prices. Maraming mawawala ng gana because you are distorting the prices and the incentives to produce or import to increase supply.
Ray Pelayo, UNTV News and Rescue. We serve the people. We give glory to God.
The Philippine Food and Drug Administration urges the public to wait for their approval on an application for the use of ivermectin as a potential anti-COVID medication. Aiko Miguel will tell us why.
Many personalities, including government officials and local manufacturers, support the use of ivermectin for COVID-19. But Food and Drug Administrator Director General Eric Domingo emphasized that the drug is not registered as treatment for COVID-19. Currently, ivermectin is only approved for veterinary use to prevent heartworm disease in animals. It is also a drug for parasite infestation, such as head lice and scabies. This is why testimonials of personalities can't be used as basis to use the anti-parasitic drug.
As an anti-COVID-19 drug kasi, kulang pa talaga yung pag-aaral. Ang scientific review kasi it has to be talagang widely proven, no? Bago natin makita. Hindi kasi mataas na level of evidence yung mga testimonials or yung mga anecdotal reports. Bago ma-approve ang kahit ano pong gamot na ginagamit sa buong mundo, kailangan talaga dumaan sa siya masusing pag-aaral. At saka ma-prove talaga niya na useful siya. So until then, hindi pa talaga natin siya ma-approve as a COVID-19 drug. Pero yun nga, as an anti-parasitic drug, maaari naman talaga siya i-register dito sa Pilipinas.
Even Merck, the manufacturer of ivermectin, said that there is no scientific basis for the potential effect of the drug against COVID-19 based on the conducted preclinical trials. FDA confirms one manufacturer signified their manifestation to apply for a certificate of product registration for ivermectin, but as an anti-parasitic for humans and not as anti-COVID-19 treatment. Once this is approved, this will be the first CPR issuance on ivermectin as an anti-parasitic drug for humans in the Philippines.
Meron nang isang nag-apply for a certificate of product registration. And we also met with them and then told them the process and the requirements. At sabi nila, magsasubmit na rin agad sila ng requirements as soon as they can. CPR as an anti-parasitic. Kasi mahihirapan pa sila na mag-apply ng CPR as an anti-COVID-19 drug dahil wala naman pa tayo talagang very clear na scientific evidence for it at this time.
DG Domingo also adds, given that ivermectin has no existing CPR, medical professionals can apply for its compassionate special permit for patients. But FDA also warns, medical professionals are liable if ever a person experiences serious side effects after taking ivermectin.
May posibilidad na magiging useful itong ivermectin against COVID-19. May possibility din kasi na hindi. At hinihintay lang po talaga natin yung mga resulta ng mga clinical trial dito. But in the meantime, ang talagang approval ng ivermectin isa sa anti-parasitic. So pag ginamit po natin siya, ito tinatawag nating off-label use, no? Meaning depending on the wisdom of the doctor, examination niya sa pasyente, naiisip niya na maaari itong gamitin para sa ibang sakit aside from the sakit na talagang design ng gamot na ito. Bilang health workers, responsibility natin ito, no, na maiintindihan ng mga pasyente natin kung ano yung mga gamot na ibibigay natin sa kanila at yung mga maaaring maging epekto nito sa kanilang katawan.
FDA does not also recommend the distribution of the drugs without a compassionate special permit. FDA warns never buy claimed COVID-19 treatments like ivermectin and Lianhua Qingwen online, for this may bring more harm than good to people. Most of all, FDA emphasize these drugs are not registered treatments for COVID-19. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
With medicines making headlines as potential treatments for COVID-19, an infectious disease expert reminds the public of its possible negative effects while studies are still ongoing. Arlene Delgado will tell us why.
As COVID-19 cases in the country continue to rise, some Filipinos, even politicians, are clinging onto drugs claiming to have properties treating COVID-19. For one, the anti-parasitic drug ivermectin. Even Anak Kalusugan Parlist Representative Mike Defensor admitted that he used the drug when he contracted COVID-19. But infectious disease expert Dr. Ron Jean Solante is not recommending the drug as possible side effects have yet to be established.
We don't recommend these drugs and in fact for patients with COVID. So mayroong mga detrimental effects yan sa side effect na hindi pa natin alam na that can also damage your liver or kidneys, no? And the fact that it has not yet been approved by the Philippine FDA and the other clinical societies like PSMID, siguro you have to be careful in taking these drugs, no? And you need the advice of your clinician.
Another drug, the Chinese traditional medicine Lianhua Qingwen, is being used by some COVID-19 patients. Metro Manila Development Authority Chairman Benher Abalos also testified on how the drug helped him in his bout with COVID-19 last year.
I took 3 times a day, 4. So that's 12 tablets a day. Pagising ko, the following day, siguro mga alas 8 lang, alas 9. Nagising ako, basang-basa ako ng pawis. Sabi ko, what's happening to me? And then, you know what? Nawala lahat ng symptoms ng flu. Although yung cough, nandun pa yung cough.
According to the Food and Drug Administration, Lianhua Qingwen is a registered drug in the country for lung ailments and flu-like symptoms and not for COVID-19. The FDA also reminded the public that the medicine still needs a doctor's prescription.
So available po talaga yan sa mga butika, no? Pero prescription drug po siya kasi may mga dapat pag-ingatan, yung mga high blood, for example, tsaka may mga gamot po na hindi siya pwedeng ihalo, no? So kailangan pag nireseta sa inyo ng doktor, alam ng doktor kung ano yung mga gamot na tinitake ninyo para alam kung pwede siya sa inyo.
The importer and distributor of the drug, the Philippine Archipelago International Trading Corporation, also warns the public from purchasing the fake versions being sold in the market. The packaging should be FDA approved and does not contain the Chinese version or the generic English version. Meanwhile, remdesivir shots are also being used for critical and severe COVID-19 cases, but only through a compassionate use permit from the FDA. Health authorities say it is not yet recommended for mild and asymptomatic cases. Dr. Solante further clarified that not all COVID-19 patients should be given the shot.
Like for example, remdesivir, it can cause renal problems. And so when you have a patient with kidney problem, you don't give that to those patients.
With the emergence of various potential treatments, the FDA reduced its call for the public not to buy unregistered and unregulated drugs. Jorlene Delgado, UNTV News and Rescue. We serve the people, we give glory to God. The local government of Manila has started distributing cash subsidy to residents affected by the ECQ re-implementation. Dante Amento reports.
The Manila Police District has assisted the Manila LGU in distributing the financial assistance to ECQ hit residents. This is to ensure health protocols are implemented. In Barangay 20, personnel from the Police Station 12 and Special Mayor's Reaction Team or SMART, while the distribution of financial assistance still ongoing for more than 10,400 beneficiaries. Barangay officials said they will proceed on distributing the financial aid until tonight.
Kung makikita natin na safe, nakaabutin tayo ng gabi, diro-diretso lang. Nandito naman po ang ating kapulisan, kanina pa ho sila nakaready.
Mabilis naman po ang bigayan kasi naka-ready naman po ang barangay certification at valid ID. Wala na pong ibang hahanapin sa kanila.
Every qualified household in Manila will receive 4,000 pesos in cash.
Basta po, kung sino, yung pong nasa payroll, regardless kung ilan po yung anak, basta nasa payroll po, 4,000 ang tatanggapin.
A total of 1,523,272,000 pesos is allotted for ECQ HEAT residents in Manila. Meanwhile, Parañaque City and Quezon City will start distributing their cash aid tomorrow. Dantiamento, UNTV, News and Rescue. We serve the people. We give glory to God.
The DOST Vaccine Experts Panel recommends that COVID-19 survivors be inoculated against the disease 2 weeks after they recovered. The experts also suggest that Sinovac vaccines be given to senior citizens. Aiko Miguel explains to us live. So, Aiko, why are these recommended by the Science and Technology Department's Vaccine Experts Panel?
Yes, Harleen, infectious disease expert and member of the Department of Science and Technology's Vaccine Experts Panel, asserts that 90 days or 3 months is too long for a COVID-19 survivor to wait before getting vaccinated against COVID-19. Dr. Rontin Solante says this is why they are sending a letter to the Department of Health to recommend that COVID-19 survivors be inoculated 14 days after their recuperation. Here is Dr. Rontin Solante.
Why will you wait for 90 days? Now, if you get the vaccine, if you get the infection and then you have recovered, hindi ka na mag-wait ng 90 days. You give the vaccine within that time that they are already asymptomatic and declared recovered. Ang guideline ngayon sa NITAG is that from recovery, maghintay lang tayo ng 2.
Harleen, experts are also recommending healthcare workers who had received their first dose but then infected with the COVID-19 virus to get their second jab when they're already asymptomatic and no longer infected.
Pag meron kang active infection, pag binakunahan ka, your vaccine will not work because your immune system is being stressed by that infection. Vaccine will work as long as you don't have the symptom.
Harleen, Dr. Solante also adds they have also given recommendation that CoronaVac, or the COVID-19 vaccine manufactured by Sinovac Biotech, be used on senior citizens given that the supply of AstraZeneca vaccines in the Philippines are no longer sufficient.
At this point in time, we need a vaccine for those 60 years old and above. Ang available lang ang Sinovac or ang Astra. Ang Astra, konti, merong Sinovac. Ang tanong ngayon, pwede ba nating baguhin?
Harleen, Dr. Solante also agrees that the vaccine rollout in the country is slow, but because the country has not enough vaccine supply due to the demand of more COVID-19 doses of developed countries where vaccines are also being developed and manufactured. And that is the latest live. Back to you, Harleen.
Thank you, Aiko Miguel, reporting live.
Hundreds of people were killed and missing after Tropical Cyclone Saroja caused flash floods and landslides in Indonesia and East Timor. Marvy Delphine will give us the details live. Marvy?
The combined death toll in Indonesia and East Timor has surged past 160, and search and rescue teams are racing to find more than 70 people who are still missing after Cyclone Saroja hit the region. According to local government sources in the province of Western Lesser Sunda Islands alone, more than 25,750 people were directly affected by the floods. In the West Nusa Tenggara province, floodwater submerged 10,000 homes in the village of Bima. The rains also caused solidified lava to tumble down the slopes of Ili Lewatolok volcano and hit several villages. Displaced residents have fled to neighboring Southeast Asian nations, and authorities are scrambling to shelter evacuees while trying to prevent any spread of COVID-19. In response to the extreme weather conditions over the past 3 days, Indonesian President Joko Widodo ordered the military and police to carry out emergency measures as quickly as possible. while East Timor President Francisco Guterres Noolo offered his condolences to the victims and families. Cyclone Seroja is expected to increase in strength in the coming days, but will move to the northwest coast of Australia. It is not expected to affect Australian communities for the next 48 hours, but residents are urged to monitor forecasts. Steph?
All right, Marvi, thank you for that live report. Russian President Vladimir Putin signed a law that would allow him to potentially stay in power until 2036. Let's find out why from Therese Lamboen live. Therese?
Steph, currently serving on his fourth term, 68-year-old Russian President Vladimir Putin has given final approval for legislation allowing him to run for 2 more 6-year presidential terms, which will be until 2036. This was part of the constitutional amendment which was proposed by President Putin last year, having nearly 78% approval of voters during the one-week balloting that concluded on July with 68% turnout. Officially, this law limits Russian citizens to 2 presidential terms in their lifetime, but does not count the terms served before its implementation. Therefore, President Putin's 4 terms does not count, including the present one, which will end in 2024, and will still be able to serve for 2 more terms. The Russian president argued that resetting the term count is to keep his lieutenants focused on their work instead of darting their eyes in search for possible successors. Should he decide to run and win for 2 more presidential terms until 2036, his tenure will surpass the 29-year rule of Joseph Stalin in the Soviet Union, which will make him the longest-serving Moscow leader since the Russian Empire. Steph?
Thank you, Therese, for that report. One of the pioneers of the Android systems, South Korea's LG Electronics, will be withdrawing from the mobile marketing scene. Early Briones reports why.
Tech company of South Korea, LG Electronics, will end mobile phone productions on July 31 after unsuccessfully identifying consumers, marking the first significant mobile brand to exit the mobile scene. LG in the past was one of the leading developers which upstarted the Android ecosystem, coming in third behind Samsung and Apple. LG was an innovative company which introduced the ultra-wide-angle camera. Though they were left struggling after multiple issues arise surrounding slower software updates and hardware operating systems. Their fallback could also be attributed to shortage in marketing, critics say. With only 23 million units being rolled out last year, the smartphone sector only provides for 7% of LG's revenue. This withdrawal sets its 10% of share in North America to be consumed by other companies like Samsung and Apple. Analyst Ko Iwi-yong at High Investment and Securities mentioned in North America, where it is the 3rd largest brand, LG has been targeting the middle-range models like Samsung, and now LG users will be more affiliated with Samsung products. However, this withdrawal, in the company's words, will do them a financial favor in the long term as they plan to focus on electric vehicles, smart homes, and artificial intelligence, develop more car parts and cameras. With the absence in the mobile scene, LG still plans making communication developments for 6th generation or 6G networks and offer services to LG mobile users for now. Early Briones, UNTV News and Rescue, we serve the people, we give glory to God.
Worldwide used social media platform Facebook reached over 500 million user data. Ia De Vera reports why.
Facebook encountered a massive leak of personal information of over 500 million users across 106 countries. The latest leak included Facebook's CEO Mark Zuckerberg's personal information, along with Facebook co-founders Chris Hughes and Dustin Moskovitz. On Saturday last week, the leak exposed the personal information of Facebook users in a low-level hacking forum that includes users' ID, location, birth date, phone number, as well as the user's email address. The posting of the entire dataset in the hacking forum brings danger and exposure to a larger audience, which can lead to impersonation and fraud. Facebook stated the recently leaked data is the old data that was previously reported in 2019 and said to have found and fixed this issue in August of the same year. Data and privacy breaches are unfortunately a huge part of Facebook's history, and due to previous breaches, the company was once fined $5 billion. From the repeated breaches, it was announced that Facebook would be sued to pay a larger fine of $589 billion. Ia De Vera, UNTV News and Rescue. We serve the people, we give glory to God.
And those are the reasons behind the news in other parts of the globe. I'm Stephanie C., live from Hong Kong. Good evening.
In remembrance of Brother Eli Soriano's life and works, the Members Church of God International kicks off the week-long celebration of the Legacy Continues with a feeding program and free store to serve the homeless and underprivileged people in different parts of the world. Nina Bascon has this story.
Heartfelt emotions and overflowing feeling of gratitude towards God was witnessed on Saturday when the members Church of God International Australia or MCGI chapters in Sydney and in Melbourne both had the opportunity to partake in the week-long celebration of Brother Eli Soriano's legacy as we continue to do good unto all and help our fellow men from different walks of life. In Victoria, MCGI Melbourne had the pleasure of meeting Arturo Cayabyab, a factory worker in Melbourne and a fellow, experiencing different challenges in life.
Ngayon pong may pandemya, malaking bagay po ito sa amin. Malaking tulong. Lalo sa mga tao naghihirap. Magandang proyekto ito para sa MCGI. Maraming salamat sa Diyos at binigay kayo sa amin ngayong panahon ng pandemya. Maraming salamat po. Salamat sa Diyos at isa kami sa mga recipient ng MCGI Free Store.
While in Sydney, Ayan Zabat, an 18-year-old Catholic boy, whom in spite of his young age has already experienced a lot of challenges in life, such as domestic violence during his childhood, was one of the recipients of the MCGI Free Store in Sydney.
First time ko po makatanggap nito. Salamat sa Diyos, ako po ay nakatanggap ng free store.
Extremely thankful to God for being cared for by MCGI Sydney, Ayan also gets his courage from God in order to move on and reach his dream of becoming a policeman. He wishes for MCGI to help more people in need.
Ako po ay natutuwa at pinapro po ako na kahit di ko po sila kamag-anak at pinaparamdam po nila na miyembro po ako ng pamilya. May papanalangin ko po sa Diyos ay sana po mayroon pa pong matulungang ibang tao na kagaya ko ang MCGI sa Sydney.
In the Northern Territory of Australia, MCGI Brethren in Darwin provided free grocery items to 20 families from the Aboriginal community affected by the recent flooding. While in Western Australia, 15 homeless citizens received their free food packs and free grocery from MCGI Free Store. While in some 4,155 kilometers away from Down Under Australia, the brethren from MCGI New Zealand also held multiple feeding programs and Free Store. Among the beneficiaries were LIA Trust, a charitable organization providing social services in the Pacific Island.
I was so touched with your support to the community in so many of these ethnic people. Thank you so much for this program that you provide for us. And I like to say, may God bless every one of you. And not the last one, we can continue engage for future activity. Maybe one day we come and visit you to listen to your words in a church.
Other recipients were BT Lodge and Poacher Guest House, both temporary housing facilities for the underprivileged, where 70 packs of grocery items and food packs were delivered. Waikato Women's Refuge was also another beneficiary, an organization who works with families experiencing hardship.
This is such a good organization that you've got. I've never seen anything like this.
As the legacy of Brother Eli Soriano continues, the members, Church of God International, will not cease to do good. By the virtue of zealousness and love to all mankind, we endeavor to continue the legacy as we sojourn this world with God's help and mercy. Nina Bascon, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, remembering our fellow men behind bars in Quezon City chapter is unforgotten by the members Church of God International in Quezon. Inmates in Quezon City Jail, unvisited by their own families, were given free meals as part of the MCGI feeding program. Marvin Calas reports.
Aside from the threat of being infected by COVID-19, inmates in Quezon City Jail are worried being lonely and separated from their families. Although a limited time were allotted every week to be visited by their loved ones, this opportunity was halted due to the ongoing pandemic crisis. Since then, a year have passed quickly that made the inmates seem to be neglected by the society. These prompted the members Church of God International to care and remember the solitude they are going through by a simple act of providing free meals. Nearly 500 inmates were beneficiaries of the MCGI's feeding program.
Napakalaking bagay po sa kanila. Sabi ko nga po kanina, sila po yung deprived na nga po ng liberty. At least nalalaman nila na kahit paano sa kalagayan nila, meron pa po nakakaalala sa kanila. At welcome po sa amin, anuman tulong po. Maliit man yan o malaki, welcome na welcome po para sa aming mga PDL po.
Napili po namin dito sa Quezon City Jail isolation facility kasi ito po ang facility na maraming COVID cases dito po dinadala. Syempre alam niyo naman yung pakiramdam nung positive ka sa sakit, may kalungkutan ding mararamdaman, kaya ito ang napili namin para mabigyan natin sila ng atensyon, para magkaroon sila ng kasiyahan at mapakain po natin sila.
Meanwhile, tired as they may be and being threatened to be infected by COVID-19, just to serve the purpose of duty and public service, frontliners such as nurses, healthcare workers, and contact tracers continues to fulfill their responsibilities. In acknowledgement of their sacrifices, about 100 volunteer nurses, staff, and frontliners from Barangay 168 Deparo, Caloocan City were served free meals by MCGI volunteers while they performed swab testing for the barangay residents. According to frontliners, they often struggle on time pressure, leaving them a little or no time to take breaks.
Actually po, sobra po namin na-appreciate ito pong pagbibigay po niyo sa amin ng mga meals. Actually, kumbaga parang syempre nakakawala din ng pagod, especially kami, gutom din, nandyan po kayo, and then nakita niyo yung aming paghihirap, yung aming trabaho as a frontliner po, laban dito sa ating kalaban na hindi nakikita. Na-appreciate po namin sobra-sobra po yung tulong na ibinigay po niyo sa amin.
Salamat sa Diyos, merong mga ganitong tulong para sa ating barangay. Sana ay laging patuloy yung pagtulong sa atin ng Panginoon. Nagpapasalamat ako kasi merong ganitong ipinagkakalob. Hindi lahat ng ay nabibigyan ng ganito at hindi rin lahat ay nagbibigay ng ganito.
MCGI also ensures that health and safety protocols were followed amid their aspirations doing public service. The group also assures that this would not be the first and the last time to remember our fellow men in need amid the hardships brought about by the pandemic. Marvin Calas, UNTV News and Rescue. We serve the people, we give glory to God.
And those are the reasons behind the news, April 6, 2021. I am Harleen Delgado.
Reasons we deliver to you as they unfold. Amangelo Castro III.
Because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.